As you saw when I opened that section, I have a piece of paper what I wrote in 1976 because I tried to arrange everything and record everything which could be important. So when I involved the very first patient in 1992 October, I gave him the number 1. And after that, we collected more and more people, and we recorded all the data, and that was filed very properly in the last 18 years. And from that database, we are going to show you some results. So when we analyzed the results, we found in our database there are 1,969 patients who consumed DDW longer than 1 day. This happened between 1999 and 2010. The male population was that percent, and the female, and the median age was 55 years. The median time, the mean between the diagnosis and the start of DDW was over 600 days. The median time was roughly half years. The standard deviation was pretty big. When we see the length of DDW consumption, the median time was 151 days with a high standard deviation, and this was the mean. If we put together, we could say that our follow-up period from the diagnosis to the end of the follow-up is over 5,000 years. Between the diagnosis and start the DDW treatment is over 2,500 years, and that patient consumed the water for 1,892 years. When we checked the different type of cancer, we found that one, so digestive, breast, lung, and urological brain, and all these things. And when we removed those people who consumed the DDW shorter than 91 days, so there are two groups: consumed all the people who consumed at least 1 day, and only those people who consumed longer than 91 days, we see that the percentage distribution was almost the same in the two populations. And when we compared to the National Cancer Registry, we found that in the population we followed, the breast cancer, the brain, and the hematopoietic cancer were presented themselves in a higher ratio comparing to the National Cancer Registry, and head and neck cancer were present in a lower ratio comparing to the National Cancer Registry. Roughly we could say almost, so it was very similar. We made a couple of groups of people, so we can talk about 1,969 people, everybody who consumed at least 1 day, and here is the median time between the diagnosis and start of DDW treatment. We can talk about a population who consumed the water between a shorter period of time than 91 days, longer than 91 days, those people who has died, and we can say people who are regular users, there are 99 people. If we compare these numbers, we can say that the median time between the diagnosis and the DDW consumption almost the same. We can say those who died, they started a little bit later. Those who regular users start roughly, they are very close to the number, which is represent the whole population. When we see all these numbers with the length of DDW consumption, we can see that those who are regular users, they consume longer than 1,000 days. Those who died consume, the median time is 142 days. The subgroup population is 288 days, and those who consumed shorter period of time than 90 days, the median time is only 33 days. So we could say roughly they even hardly started to consume. Without any selection, the median survival time of these 1,969 patients is 7.7 years. I think it's higher than if we take any samples from a regular population. This should be higher. But when we see the median survival time depending on how long the people consume the deuterium depleted water, that means they consume shorter than 3 months. This is between 3 and 6, between half and 1 year, 1 and 2 years, and longer than 2 years. And it's evident the people consume longer, they live longer. And here are the numbers that the people consume less than 3 months, the median 0.7 years. Here there is a big jump. Even the people who consume longer than 3 months, they dramatically can increase the median survival time. And those who consume longer than 2 years, the median survival time is over 17 years was. We could say, if we say that, of course, to see some effect with DDW, the people have to consume the DDW. And we say that the 3 months could be critical because only 11% of these patients consume the 1 year period who consume longer than 3 months the DDW. But those who consume shorter, who consume longer than 3 months period, 77% live longer than 1 year period. If we make the group and see the group of those people who consume longer than 3 months, so that was 1,300 patients, our median survival time went up to 9.3 years, which is definitely a good number. There is one subgroup I would like to show. Of course, this is the best group. Those people who were diagnosed, who started to consume the deuterium depleted water, they, in most of the case, sometimes they got a remission, but even they were in remission, they come back and they started to consume DDW again, and after a while they make a break and so on. So we had 99 patients. That was the ratio between males and females, the median age 56 years, and that was the distribution of different tumor types. This is quite similar than the whole population. And just to mention that regular patients, that 99 doesn't mean that they were operated and when they started they were in complete remission. So 65 patients were in a very, very advanced stage: anaplastic ganglioglioma, melanoma with liver metastasis, head and neck cancer patients, colon tumor with liver metastasis, or there are people who had relapsed several times before started to consume DDW, breast cancer with distant metastasis, as Muriel mentioned. So 65 out of 99 were in a very, very bad stage with a poor prognosis. And when we see the median survival time, the cumulative follow-up of these 99 patients was 585 years, and 8 patients died out of the 99, and of course we were not able to calculate the median survival time because the death rate was so low, even that the follow-up period was over 500 years.